Recently, I had a patient ask me a really important question. What does the research show about sex drive decreasing with age? Now, his question was really related to him dating women in his age category and finding that many of them viewed sex as more of an obligation than something they wanted for themselves. He told me that this caused him to feel less attracted to those women, and he didn't want to pursue relationships with them because sex was important to him. But unfortunately, as he was finding this over and over again, he realized he was really narrowing his dating pool. So he wants to date women in his age bracket, which is over 65, and he wants to date women who are interested in having sex. I'm Dr. Emma Blake, men's health and urology expert, and today we're talking about something that doesn't get discussed enough: sex drive, dating, and intimacy after 65. Make sure you hit that subscribe button and turn on notifications, because we're having the honest conversations about sexual health that most doctors won't touch. Here's what we're covering today. First, what the research shows about sex drive and aging. Then, why some women lose interest in sex and what's really going on. And finally, practical strategies that can help reignite desire and create better intimacy at any age. Stick with me, because this is important whether you're single, dating, or in a long-term relationship. Now, I explained to this gentleman that yes, the research does show that hormonal changes and aging can impact sex drive, but it's not an automatic elimination of desire. There are so many factors, such as your overall health, the amount of stress in your life, the relationship you're in or looking for, medications you take, and the way you see yourself. All of these play a significant role in how much you desire sex and intimacy. And here's the good news. Many people remain sexually active well into their later years. The frequency of sex and the nature of intimacy might shift as our bodies change, but that doesn't mean sex becomes impossible or undesirable. It just means it evolves. But let's talk about the core of his question, which is why some women lose their interest in sex and how to potentially reignite it. As I explained to him, many women of all ages, but especially older women, have experienced literally years, maybe even decades, of negative or unfulfilling sexual encounters. Here's the statistic that might surprise you. 1 in 4 women regularly experiences pain with sex. Think about that for a moment. If that was a part of her previous marriage or previous relationship, it's going to be very difficult for her to reignite her interest in doing something that she considered to be painful, or that she found to be an obligation rather than a source of pleasure. That just makes sense, right? It's also true that hormonal shifts in women, especially during and after menopause, can make penetration feel uncomfortable unless it's properly approached. This includes using lubricant, lots of foreplay, and plenty of communication. Without these things, penetration can be uncomfortable or even painful, which causes women to want to avoid sex, especially penetration. But here's what I shared with him that's so important. If you make pleasure and intimacy the goal, instead of just penetration and orgasm, you'll be opening up a whole world of possibility. That world does include penetration, but it also includes so much more. The key to really connecting with a woman, especially a woman who's reluctant or doesn't feel confident that she wants to be sexual, is by showing her a world of pleasure that you make possible for her. Not pressure, not obligation, but genuine pleasure and connection. It's also worth noting that some folks, as they age, both men and women, experience pain in their bodies or limited range of motion. That makes sex itself harder to enjoy. If you have to hold your body in a specific way that causes you some kind of pain, that might take a lot of the pleasure out of sex and might make it harder for you to look forward to it. This is one of the reasons why I emphasize the importance of finding positions that work for your body. Using pillows and wedges, the edge of the bed, the wall, different furniture, so that you can get into a position that feels restful and relaxed, and you can maintain it for a longer time. The idea is for folks who have any sort of physical limitation or pain, any sort of chronic discomfort that they're dealing with, or any pain during intercourse, that we're giving you modifications so you can support your body, stay in positions longer, and reach the spots that provide maximum pleasure without causing pain or exhaustion. So if you find yourself avoiding sex or feeling such as sex is becoming a lot of work because of the pain you're experiencing, know that there are solutions. It's about finding what works for your body at this stage of life. Now here's something really important. Pleasure doesn't have to be just genital focused. Show her that you can experience pleasure in all kinds of different ways, through food, through touch, through experiences, through an emotional connection, through intimacy as a whole. If you can demonstrate for her that pleasure is accessible, pleasure is possible with you, that pleasure is easy and constant, that is going to open up more possibility, more doors to her being more open to pleasure in general, and pleasure through sex and intimacy in particular. If she's able to shift her perception of sex away from a duty and towards a way of accessing pleasure and connection and exploration, she's going to naturally be a lot more interested in having it. So the more that you can prioritize sensuality and a full range of intimacy, the more that those things will feel possible, accessible, fun, interesting, and desirable for her. Here's what I want men to understand. Many women have spent years, sometimes decades, having sex that didn't feel good, that hurt, or that they did out of obligation. Changing that perception requires patience, genuine care, and a willingness to prioritize her pleasure without expecting anything in return initially. Start with non-sexual touch, massage, hand-holding, cuddling. Show her that physical intimacy doesn't always have to lead to sex. When she feels safe that you're not always pushing for penetration, she'll be more open to exploring intimacy. Focus on her pleasure first. Make it about her experience, not your orgasm. When she experiences genuine pleasure without pressure, her desire will naturally increase over time. Communicate openly. Ask her what feels good, what doesn't, what she's comfortable with. Create a safe space where she can express her concerns without judgment. Use quality lubricant. This is non-negotiable for women after menopause. Dryness is a real issue, and proper lubrication can make the difference between painful and pleasurable sex. Extend foreplay significantly. What used to take 10 minutes might now need 20 or 30 minutes. That's not a problem. That's an opportunity for more pleasure and connection. Be willing to redefine what sex means. It doesn't always have to include penetration. Oral sex, manual stimulation, mutual touching, these are all valid forms of sexual intimacy. Address any erectile concerns you might have. If you're dealing with ED, get it treated. Women often feel responsible when their partner can't maintain an erection, which creates more anxiety around sex for both of you. Here's the bottom line. Sex doesn't have to end later in life. No matter what kind of sex or what kind of intimacy you've had up until this point, you can experience something better, something more enjoyable, something that feels really good. It's just a matter of creating a path where pleasure is a natural outcome instead of the only goal. For the gentleman who asked this question, my advice is this. When you're dating, be upfront about the fact that physical intimacy is important to you, but also be clear that you're willing to take time, that you prioritize her pleasure and comfort, and that you're open to exploring what intimacy means at this stage of life. You might find that some women are genuinely disinterested in sex for various reasons, and that's okay. That's a compatibility issue, not a judgment. But you might also find that many women are open to intimacy when they feel safe, when pleasure is prioritized, and when there's no pressure to perform or do anything that causes discomfort. The women who seem disinterested might just be protecting themselves from repeating painful or unfulfilling experiences. If you can show them something different, you might be surprised at how that disinterest transforms into genuine desire. So if you're navigating dating and intimacy after 65, know that it's possible. It's worth pursuing. And with patience, communication, and genuine care for your partner's pleasure, you can create a fulfilling, intimate relationship at any age. If you found this helpful, hit that subscribe button. Drop a comment below about your experiences or questions around dating and intimacy later in life. I read every comment. And share this with anyone who might benefit from this conversation. Thanks for watching.